Okay, so it may not be many people's favorite topic of conversation. Perhaps that's because when you even mention the words Affordable Care Act, right off the bat, it can be quite confusing.
Yeah, so today we're making sense of it all and what you need to know now that open enrollment is underway.
First, a little bit of a background on the Affordable Care Act, commonly referred to as Obamacare. The president signed this federal statute into law back in 2010. According to the Department of Health and Human Services, the idea behind the measure was to put consumers back in charge of their health care. The government says with the Affordable Care Act, all Americans have access to affordable health insurance options.
Basically, everyone has the option to shop on their state's or a federal health insurance exchange website. You buy a health insurance plan you can afford.
Now, the thing about the Affordable Care Act is all plans must offer at least the following 10 benefits: ambulatory or outpatient care, emergency services, hospitalization, lab testing, maternity care, including prenatal visits, mental health services, pediatric care, prescription drugs, preventative care such as mammograms, pap smears, immunizations, and well visits, also rehabilitative care and equipment. Now, there is another stipulation when it comes to the Affordable Care Act.
If you fail to comply and you do not have insurance, you must pay a penalty.
Yeah, many people have taken note, and whether they really want or need the insurance, or perhaps they're just trying to avoid the penalty fee, millions are signing up.
But you can't talk about signing up without bringing up the infamous botched rollout of the program a couple of years ago. Perhaps you're one of the thousands of people who received this message on the website. Consumers were blocked from getting health insurance because of glitches in the system.
But according to Obamacare facts, many of the website issues have been resolved and tens of thousands of people can be on it at one time.
And as we hear now, the push is on to get them signed up.
Maryland's affordable health care website crashed back in 2013 when thousands logged on to enroll.
It was discouraging, frustrating.
The website is seeing plenty of traffic again as open enrollment into Obamacare is underway. If you already have a plan, no worries. Enrollment automatically renews. But Dr. Peter Bylandson says two types of people will need to log on.
Those who don't like their policy or don't like their insurance that they've gotten on the exchange in the past, or those who are going to go on for the first time.
Last year, the website's second year, more than 100,000 Marylanders got onto the exchange to get affordable coverage. But healthcare workers say there may be fewer people searching for plans this year. One reason may be the website's reputation.
People who may have tried to get on in the past may have been so disgruntled from having trouble getting on in the past that they may not try again.
And the doctor says every year the health care exchange gets better. The Department of Health and Human Services estimates about 10 million people will be enrolled in Obamacare by the end of next year.
Now, there is a lot to the Affordable Care Act. It would be impossible to cover it all in just a few minutes, but you can still get the help you need to maneuver through it all.
Joining us today to tell us how is Kat Gumby with the Lower Shore Health Insurance Assistance Program. Thanks for joining us this afternoon, Kat. Okay, so as we just learned, there's an automatic renewal system in place. How's it working?
So far, we're 1 week in, and it's making things go much smoother. People who went on the system and signed up last year have an opportunity to be automatically renewed if they liked their policy and were happy with the amount of the tax credit they got and didn't want to make any changes, then they move right over into the policy for the next year.
Wow, that does sound easy. Now, in general, is it going to be easier to sign up for it this year?
Yes, I think so, for a lot of reasons. One, we're in the third round of this. Maryland's done a great job on improving their website. It's been functioning very, very smoothly this year, and our navigators are almost experts in the system. They've been in it from the beginning when they had to enroll people with spreadsheets and handwrite everything down, to now being really the experts in the policies that are available and being able to better guide people through the website.
But still, there are those people who choose not to sign up. Let's talk a little bit about the penalty.
The penalty is $695 per person in a household, at $347.50 per child. It wouldn't go up to above $2,085 for a whole family, or it could be 2.5% of a household's income, whichever is higher. So that is, starting to be more of a stiffer penalty to really hit people's pocketbooks and make them sort of force them to make the healthy selection of having insurance as it is required.
Make that decision. Okay, we kind of touched on it. Who does not need to sign up?
There's a few people that have exemptions because of hardships, or people who only lacked coverage for less than 3 months. People who are very low income or are members of certain groups may not have to have the coverage.
Okay, so we just talked about open enrollment. When does that end?
Open enrollment this year is November 1st to January 31st. So people can go online themselves or call, set up an appointment, have in-person help anytime during open enrollment.
And people can get an extension too, though.
Well, life happens outside of open enrollment, obviously. So if people have special life circumstances such as a birth, marriage, divorce, death in the family, loss of a job, they may qualify for what's called a special enrollment period and enroll outside of those dates.
Okay, still can be overwhelming, but help is available.
Yes, sir. We have a team of people who are called navigators, and their job, they've gone through extensive training with the state exchange and at our own health department. Their job's to help people navigate through the process. It doesn't need to be intimidating. We really are here to help. It costs nothing for our services of our program to help people through the system and make it something that's understandable and relate to their own lives.
And you have sessions coming up to help.
We do. We have people can have appointments, or they can come to one of our public sign-up sessions. Our first one is this Saturday at the Civic Center from 10 to 2.
And you need to bring certain things.
Yes, to make sure that you have all of your social security numbers for everyone in your household, your income information for your household. It's helpful if you have tax information from last year, that's helpful. And if you currently have insurance, bring that information as well.
Okay, so to simplify this completely, it can be done.
It can be done, and it can help you be healthier. It's something that people really should want to have. I mean, as you just mentioned, preventative services are at no cost. They're part of the essential benefits package. You want to make sure your kids are immunized, that they get their flu shots, that you have your annual exams, because for many people on the shore, if you can't go to work because you're sick, you can't bring home money to support your family. And having healthcare coverage helps people do that.
Preventative care is key. Thank you so much, Kat. And to read more about the Affordable Care Act and how you can get help signing up from the Lower Shore Health Insurance Assistance Program, go to WVOC.com, click on our picture at the top of the page. Now that we know how we can get help with what could be a confusing process, let's take a step back into a simpler time when toys were handmade. It's the busy season in this toy workshop. These local woodworkers have to have 1,500 trucks, wagons, and baby cradles ready for under the tree. Find out why they take on a project that would likely overwhelm even Santa Claus.
And what we're making in the Delmarva Life Kitchen will overwhelm you with flavor. We are making homemade salted caramel sauce, or what I like to refer to as awesome sauce. Delmarva Life, we'll be right back.